Today we're joined by Dr. Farai Makoni, who's based in the UK. He's a Zimbabwean, was in the Zimbabwean public health sector, was involved in a lot of policy advocacy, was also a general practitioner, but now he's based in the UK, is a specialist trainee there. Dr. Makoni, thanks for joining us and speaking to us about COVID-19.
Thank you, Napoleon. Really good day.
Aiwa, tiri vapenyu. Chatoda kunyanya kunzwisisa doc. Nimi muri ku-UK ko, and in the UK, in the last few days, it has been very hectic. I think as of yesterday, they were recorded about 88,621 cases of COVID-19. And then in terms of deaths, it was plus of 11,300. Saka, what is really happening on the ground?
Okay, so I think basically the figures say it for themselves. What I would like to say is probably when you talk of those deaths to be, there are more of hospital deaths, and we don't have the community deaths component input figure, because my updates on those deaths is actually deaths that have occurred in patients who have been admitted. The disease is going on. People have been admitted. People are getting sick, and it's not the best of times that the services are going through kunoku. So yeah.
Kunoku kwakamboita kamutauro, vamwe ungane mafungiro ekuti chinenge chirwere chevarungu kana kuti isusu vanhu vechitema hatingatinyanya kutibata. What is the situation there? Is it are black people, more so Africans, more so Zimbabweans, being affected or infected by this disease?
I think it's something that I would have wished if that was going to happen, it was going to be something that would have us as Africans. But sadly, as the events unfolded or are unfolding, we've sort of tended to see more of what we call the minority, black and ethnic minority groups being affected more. Reasons being subject to more discussion, but it's actually said that they constitute a smaller proportion of the population here. But when you look at the statistics, they are actually contributing about one third my admissions and my deaths are equal. So that's quite significant considering that they are ethnic minority groups and them getting to have been affected that much. The debate can be brought about. There's been discussions about why has this been like this, and one of the things that has been brought forward is Vagara, the black and ethnic minority groups are the ones that sort of have no ones who affect when socio-economic kind of problems. My risk factors are to out one underlying conditions do affect wawaya ndo kwaanowanika kuma black people and ethnic minorities ndokunikwa kwawanda my underlying conditions. So to some extent that sort of explains it. Then coming down to Zimbabweans, just like you've said, I mean, one of the reasons I think we have been affected as Zimbabweans here, with sadly I've heard of quite a few deaths. As of yesterday, I knew of 6 people, Wandakans Wainini, I mean, having passed away on social platforms that I am on, which is very sad news. But one of the things that people that I actually know, yeah. So I've known about 6 now as of yesterday who have been. These are Zimbabweans we're talking about who have been, sadly, succumbed to this virus. And one of the thought was, is it because you find most Zimbabweans or Africans who come here are mostly in the health sector? So that again can speak to say, is it a question they are quite exposed, and one of them my exposure rates are quite high, that's why they are developing these things? Or it's just the whole pool of thought are these part of the risk factors, the black and ethnic minority groups who are not my underlying conditions? But sadly, that's the situation we have.
Doc, you worked very, very extensively in public health when you were still in Zimbabwe. And looking at the issues that have come out in terms of prevention, because I would imagine that prevention is the best strategy for Zimbabwe at the moment. In terms of prevention, we've been told of things like constant hand washing, which is sanitizing your hands, but mostly with soap and water, running water, sanitizing with an alcohol-based hand sanitizer, any alcohol content above 60%. We've been told of social distancing, staying away from people. Can out in public for any reason, you should be 1 meter to 2 meters away from the next person. Anyone interact and I see the story that has been pushed the most is Garaigumba. Right now, there's a lockdown in the country where even security forces are on the streets saying Garaigumba if you are not an essential service. So what my question is around this is, all these measures are quite difficult for Zimbabweans. One, because even running water is very limited, if not scarce. And then we talk of social distancing and staying at home, which is also difficult because a lot of Zimbabweans, their business is hand to mouth. And if you stay at home, you risk starving. So in light of these limitations that we have as Zimbabweans, that other countries do not necessarily have, what would you recommend? What would you say kuti as Zimbabweans ngatitei so kuti at least tikwanise kupreventa, because chikazenge chaita breakout kunokuka zvinogona kutinetsa kuzochicontain. So to prevent, what are the measures that we can how can we overcome some of these situations?
So like you're saying, I mean, there are inherent problems that are already there, and things like that. But I think, to be fair and to be honest, say people always have a way of finding how they wash their hands. I'm actually proud of us as Zimbabweans, because we've had situations where we had things like cholera. Into the habits of knowing that tinogeza maoko tisati tadya, tinoita all those things. And to comment and say, it was very shocking for me, it's pane instances to say, in some of these developed countries, something that we are already used to as Africans, which is something that we can actually capitalize on. Kugeza maoko can never be overemphasized. Whether there's running water or not, we find ways of protecting ourselves, because sometimes if we cry for at the end of the day, when you get the disease in Diwe, there's no cure is one thing that we should know. There's no vaccine as yet is one thing we should know. And our health sector is not in the best position right now. So we need to do our best to protect ourselves, to prevent ourselves from getting it. And if we do get it, we need to do our best to limit the spread, because the very limited resources that we have should be stretched for very long. To make sure that my cases are now acharamba ari mashoma kana ari cases are spread is at its minimal, so that the little resources that we have can be able to be stretched longer and see us through past diseases. So if anything, I would think isusu, our part should kick in more on the preventative part, more so because kanatika pura prevention, when it spreads and things like that, we will struggle. For instance, as we struggle as a nation, tests, particularly because maybe one of the things I would assume is my test kits are quite limited. Now, if we get to the point, and things like that, which we're already getting, I'm sure, from the information I'm sort of gathering, we then get to use up all the resources that are in, as it's quite limited. So washing your hands, avoiding kubuda. I know it's difficult. We've got a stone to cook right here. This is what it is. But we still need to sit down, calm our heads, put our heads together and say, Toita says, as a family, people make my personal decisions. You can toil and wail, but right now I don't think that's the right time to sort of focus on those things. I'm talking at an individual level. This is the situation we have. At best, you need to prioritize making sure you do not get it, or if you do get it, don't spread it.
We aim to prevent. Exactly. However, in the event that pane mumusha medu akosora stereki akaita chest pain akataura kuti ndiri kunzwa kuzarirwa, a fever, and all those different symptoms that have been said to mean kuti panenge pane corona. What is the protocol generally, first of all, around the world, but I'm not sure if you're aware of the Zimbabwean protocol at the moment, which as the general public, tinofana kuita sei, chii chekutanga chandinoita, and what are the steps that I take pakatanga kuita chikosoro ichocho nemasymptoms?
Okay, so there's been so many changes in terms of guidelines. It's a good Twitter with COVID. I'll speak to the things that we are exposed to right now. I'm not very sure or aware of my policy guidelines I Zimbabwe in terms of but I'll give you a rough synopsis how are they handling it. For instance, the advice has been obviously when you develop a new cough, they say a new dry cough that is persistent. By persistent, they mean by 24 hours, a cough that is more than 3 to 4 times in each 24 hours. Then they classify that as a persistent cough. A temperature greater than 37.8 for more than 3 days, my symptoms are. This is what the guidance is here. Then you qualify to get into what they call the case definition, a suspected case. But while you are a suspected case, you then get the advice is then can I say suspected case or a fever. You get isolate, you self-isolate. Self-isolate is probably going to be for 7 days is the guidance here. Assuming that after 7 days, my symptoms should they may be there, but you can come out of that isolation. In English, then in terms of when you should call for help, in terms of caller for help, here we have the 111. I want to say caller for emergency services, which has been very overwhelmed, right? My current times are the times that you are able to call and talk to services, anyone on the other hand, my services at 111, is when you have a worsening of symptoms. And by worsening of symptoms, I mean after 3 days or more, temperature and you're getting worse. We must also remember in these times that anything else, quits up temperature, does not stop to happen because we are in a COVID time. So we should also have at the back of our minds that quits the temperature, I can still have tonsils even now. So they are going to have that temperature if they are going to have it. Otitis media, some ear infection. Malaria, thinking back malaria, I can still get malaria. So to have our mind think around all that, typhoid, these are things that happen every day. So we must also be clear what symptoms and how are they progressing. Temperature in self-isolate, and the preponderance is to because there are these guidelines self-isolate, it's already COVID, or it automatically becomes COVID, might sometimes make us miss a few other things. So not sure what the guidelines will say there, but certainly here, this is what it would say.
So just to reiterate, at what point does the person get tested? Which pattern?
Okay, so in terms of testing, it's not something that is routine. Test persistent symptoms, right? 1, 2, or you start deteriorating. Then before they administer treatment, they will need to confirm the diagnosis, and they can only do that testing you. Yeah. So I self-isolate right, if I come out of it without any problems, then that's it. I won't get tested. But should I deteriorate or something else is just not well, I'm deteriorating. They will need to know how to manage, because my guidelines of managers are not. This then comes back to the point une malaria, your temperature goes so high and all other malaria symptoms start coming in. At that point, then I'll think the guidelines would then say, make sure that my testimony is this COVID. If it's not COVID, then you look for other causes. Malaria, because they can still get those things.
Okay. Saka ipo pa period yo yekuti ndaita ma symptoms and then but asati persistent and asati deteriorate zvokuti ndingaende kuchipatara unotestwa. So ndaita ma symptoms, I've self isolated at home. And that self isolate and this will relate to whether it's my family or vanhu vandinogara navo, whether ndivamwe maroja ari panzvimbo patinogara or whatever. Ndazvisa muroom mangu ndega. What are the possible home remedies that can get me back to a healthy point without having to go to the hospital to then get tested? Maybe itori corona zvesure, but is it possible that ndiri kumba ndinogona kunwa something kana kudya something kana kuzvibatsira ndega ndotodzokera kuita 100% health ndisina kumboenda kuchipatara unotestwa?
Well, I would say we will be like anything else. There's obviously something that you can do to help yourself. What I would say is, I've not, it's just something that I've sort of set down and say in my guidelines. But I would think the symptoms will guide us. Kana munhu ari breathe fast, any temperature, they'll get what we call insensible losses. Insensible losses are urikuluza zvinhu zvinenge mvura mumwiri mako usiri, not the usual way, because here you sweat, you unoita weight, things like that. That's how you lose it. But if you are losing extra, you sweat a little extra more, so you lose more water. Remember, you breathe out humid with some, so you lose quite some fluid. One of the things that I would think that would be very useful is keeping very well hydrated. And like any other flu, keeping your base immunity right. Things like having vitamin C, my fruits, things like that. All those things are things that could be useful. I've heard people talk of steaming. I don't know how far true, whether there's evidence to back it up or not, but I would think that because steaming, increases, it speaks to fluid replacement. I would think that it's something that can actually be useful. So yeah, indeed, there are things you can do at home that will help you. Just having a balanced diet, making sure your base immunity is right, having lots of vitamin C. Not in excess, of course, but just having vitamin C that is enough to boost your immune system should be good enough. Keeping well hydrated should be good enough.